mai kako. Thank you for joining us for the second half of our presentation today, talking about long-term care, particularly on the Big Island. My name is Russell Kokobun. I serve as the senator from the 2nd District on the Big Island, which includes all of Ka'u, Puna, and part of Hilo. And I'm joined today by my co-host, Bob Lindsay, the Hawaii Island trustee for the Office of Hawaiian Affairs. We also have a number of distinguished guests with us today, and I'd like for them to introduce themselves just so that all of you in the audience can know who they are.
I'm Dr. Craig Shikuma. I'm a solo practitioner since 1980, a native of Hilo, and I'm long-term care director at Hilo Medical Center, also East Hawaii Regional Board member.
I'm Stuart Ho. I'm a president of AARP Hawaii and also chair of the State Long-Term Care Commission.
I'm Lisa Fujikawa, the general manager at Regency at Hualalai, which is an assisted living facility in Kailua Kona on the Big Island.
Well, I guess maybe if we could just very quickly get to some on-the-ground solutions to long care here in Hawaii. In our first segment, we talked about framing the issue and the challenges that we are facing. So, you know, you're on the ground, Lisa, on the west side of our island. In terms of solutions to the crises, to the train wreck that Stuart, you know, has so graphically described we are facing, what are some of, in terms of solutions?
It's such a complex problem. There's the bed crunch that everybody talks about. One of the solutions is if the long-term care residents that are in nursing homes, if they are at a level that can be taken care of in assisted living, then that would free up the bed in the nursing home, which would allow the acute care hospital to move a patient there, which would free up the bed in the acute care setting. That's one solution of the problem. The other problems of, you know, the shortage of caretakers or CNAs. The programs are very limited and they're expensive for the average caretaker who wants to get this training. It's $800 to $1,200 per person. If there could be some funding either to facilitate these people to get trained, then there would be more care workers in the community. Increasing community services. Everybody wants to be taken care of at home, but yet they're not safe at home in a lot of situations. Setting up, kind of thinking out of the box and doing a kind of a neighborhood watch program, kind of a community-based, you know, where just like home health nursing, where we have, you know, people to go in and check on these folks to make sure they're okay before they get to a level of where they would have to go into either assisted living or a nursing home. The problem is so complex that there's many ideas to go along with the problems.
The interesting thing about the complexity of the problem also kind of spills over into how do you access these services and who puts them in order. And for any one patient, you know, every patient is a special case. You know, how are you going to know what services are even available for that patient? And we run into that problem in private practice. I run into that problem a lot. You know, I just don't know what's available a lot of times, or you know, what service would fit this patient, what can help this patient with chore services, or what can help him with his bandages, or you know, You can get organizations involved, but sometimes there's overlap between organizations that help out a patient. Sometimes they don't overlap, and maybe they should. I don't know if there's some kind of way to organize, organize services where you can take out the universal playbook on this patient who just had a hip fracture and is kind of unsteady at home. Okay, what can I access for this patient? A, B, C, D, E, F. The Office of Aging tries to do that on the Big Island. I think they do a pretty good job, but funding, government, and
Yeah,
so forth.
Craig, is that ADRC, that the new facility or at Sunset Lawn? Is that the Office of Aging that you
No,
facility you're talking about?
County Office of Aging is
Okay.
what we access.
Mhm,
So they help out the physician's office, but I'm not sure if that is their primary goal. I think they do organize services quite a bit, and I would hope that there is some organizational framework that as hopefully we put in more resources into different services, outpatient services, to take care of patients. I'm a long-term care director, but like anything else, I would want patients to stay at home. That's the best environment for them, especially when they're frail and they're elderly and maybe at the end of their lives. I would want to stay at home. But long-term care services, institutionalized services, especially those services where you rehabilitate patients, there's always going to be a place for that. The Office of Aging statistic, I think 15% of over 65, will use long-term care services one time or another.
Mhm.
Okay, well, if we could, Stuart, can you jump in at this point?
Yeah, well, first of all, let me say that I'm speaking at this particular session as president of AARP Hawaii and not as chair of the Long-Term Care Commission.
Yes.
Because we have what the Long-Term Care Commission is doing it's basically a work in progress, and so I don't think it's reasonable for me to express any views on behalf of the commission. AARP has been deeply interested in this thing for quite a while and at the national level, we're getting a lot of national attention on Hawaii by the national organization. Its research facilities have been made available to us, and they've had a couple of very, very deep and good surveys conducted of Hawaii and of all the islands, as a matter of fact. And the most recent one was in 2008, January of last year, and I'll get into that in a second. But talking about solutions in general, my belief is that what the long-term care system needs is nothing less than a very large infusion of capital, of money. And the industry itself can basically sort itself out by demand supply, but unless that infusion of capital is there, you're not going to see a lot of attention paid to long-term care services. The AARP last year did a survey of basically, where do we get this money? Let me start with that. It's fairly clear that the state can't afford to pay for the bill. They can barely afford to pay for the bills they got right now, let alone a new program of, say, long-term care. It's pretty clear also that the federal government, with its umpteen $1 trillion deficit, is probably not going to get around to long-term care, even though Senator Kennedy has a separate bill in the Senate on long-term care insurance, a national long-term care insurance program. It's not even clear, it's probably less clear